In any given year, 1 Canadian in 5 personally experiences a mental health issue, and half of Canadians have or have had a mental illness by age 40. Not surprisingly then, this year in particular has seen the trend increase, with half of Canadians reporting they've experienced a negative impact to their mental health as a direct result of the COVID-19 pandemic. Consequently, many government bodies in Canada predict an unprecedented mental health crisis with long-lasting implications. A recent survey HR Downloads conducted found employers expect this crisis to affect their organizations, naming several mental health challenges to their employees, including fear of exposure to COVID-19, family care concerns, and anxiety related to demands from customers or patients. Employers should assess their workplaces for mental health hazards and do everything reasonable to address them, but this requires finding a workable and reliable approach. We must rethink how we manage mental health in our organizations. For one, we need to get rid of some misconceptions about mental health. A big one is the myth that mental health issues are just in your head. Not only does mental health affect physical health, mental health issues can be caused by external physical factors. Health and safety laws tend to focus on physical hazards, but governments are starting to pay attention to the risks to health that arise from hazards like harassment, for example. At HR Downloads, we believe that we can all better manage mental health issues by treating mental health hazards more like physical hazards. One way to do this is to modify the hierarchy of controls, or HOC. The appeal of this model is twofold. For one thing, it doesn't require you or your employees to learn a completely new system, and reinforces that mental health hazards are more similar to physical health hazards than we usually believe. Just as important though, using the hierarchy of controls puts the emphasis on eliminating root causes of mental health issues instead of relying only on frontline controls like employee training on stress management or resilience. These training resources are valuable, but they can't be our whole response. So how does the HOC work for mental health? After all, mental hazards can be invisible, episodic, and more difficult to detect than physical hazards. At the organizational level, there are common causes of mental health crises that you can look for. Things like overwork, unclear priorities, unpredictable work shifts, understaffing, and exposure to violence or harassment. These can all harm or worsen mental health, and they're all hazards employers have substantial control over. This is the HR Downloads hierarchy of controls for mental health, a systematic, effective approach to mental health management that employs 5 layers of controls. 1. Eliminate the hazard. Removing the hazard entirely is always the first and best option. 2. Substitute the hazard. When you can't eliminate a hazard entirely, replace it with a less dangerous version by altering processes and procedures. 3. Reduce exposure to the hazard. If you can't change the hazard itself, change the role to reduce the hazard's negative impact. 4. Fortify employees against the hazard. If you can't modify the role to provide protection, help employees increase their resistance to the hazard. 5. Treat the negative impacts of the hazard. Where you can't eliminate or reduce exposure to a hazard, introduce measures to lessen the negative impact of exposure. Just like the normal HOC, order matters. Always try to eliminate a hazard first. Identify the root causes of hazards and never presume a hazard can't be eliminated. Employers have the most power to make big changes for employee mental health, and that means employers need to take the lead. By using the hierarchy of controls for mental health, we can create healthier employees and workplaces by design.